On behalf of the Pettibon system, welcome to today's webinar. We're glad you joined us and wanted to point out some of the buttons on the bottom of the screen. There's a Q&A button, so at any point during today's presentation, feel free to ask a question. We'll do our best to answer it during the webinar, and if there's not time to answer it during the webinar or you're watching it on replay, we'll be sure to answer that question for you. Be sure to check out the Resources tab because all of today's resources will be listed in that box there. Again, on behalf of the Pettibon system, welcome to the webinar. We hope
Hi everybody, this is Dr. Scott Sorum in beautiful sunny Washington. We are going to go through today the Pettibon cervical traction, how it impacts every one of our patients because they're all required to have it. It's an awesome piece of equipment and it is a key component to their home rehab program. A little bit about me. I have been practicing Pettibon for about 17 years. Been either assisting or lead instruction, I believe since 2004. So I've worked with the team. And I tell you, if you do this work, you will change lives, bar none. So here we go. Let's get into the first one. So we got to restore the lordotic curve in the neck, and the cervical traction is one that is key. You know, it's the best thing you can do starting your day. You know, all of our patients get into first thing, 2 cups of water. Start out with your cervical traction and your morning exercises. And we begin hydrating that disc. Spinal curves, the proper curves, are necessary for motion. And you know, the process of loss of motion begins way before there's pain. And again, the traction is one of the tools that helps those people stay fully functional. We've even seen restoration of cervical disc height through use of the cervical traction and combining it with the proper water intake. So on to the next one. Here's a couple photos of the different ways that the cervical traction is set up both in the office and for home use. You can see the picture on the left. There are a couple different setups of how you can mount it to the wall in your clinic. There are 2 types of traction. The one on the left is a thin traction, and that one, the straight bar goes under the chin, and the thick one on the right is for the forehead. That will be used with your TMJ patients, or those people that have any problems with their jaws. So let's see how the spine and the disc function. And we all took these classes in school, but we are learning more all the time. And again, this is a tool that helps restore the disc to normal form and function. So after the age of 12, you no longer have a significant blood supply. So therefore, the only way to get nutrition and oxygen into the disc is through diffusion, through the end plates. And that allows nutrients to get in and then keeping that disc healthy. You know, we all have seen a disc on film, on x-ray. It is dark in color, and that is healthy. And so that's what we're going for. We do not want to have the disc on the right where you've lost height through desiccation or drying out. As I explain to patients, you know, if you have a disc like that, it's pretty much like beef jerky. So we want to stay away from that. So it takes a full range of motion on a daily basis to create what's called osmosis and imbibition. You've got to have that to cause normal nutrition and water and fluid flow into that disc. So that is a repetitive loading and unloading process that causes that. Okay, so the parts of the disc, the annulus fibrosus is the fibrocartilage part that basically holds things in. And the center, you have the nucleus pulposus. It's made up of gel, basically like jello, and it supports about 75% of your spinal load. So we want to have the disc on the left. If you look in the bottom image in the right, we want this disc on the left, not the flattened or dried out or desiccated disc that comes with and is associated with degeneration. Excuse me. Primary function of the disc, well, it allows for flexibility in the joint, and we have these 24 movable bones in the spine. We need to remain flexible. It distributes the load. It keeps us upright. And it does, we do typically lose a little bit with age. That is normal. But again, we get into another, Dr. Christian did a seminar on wobble chair, that between the traction and the wobble, you can continue to keep those discs like that of somebody probably in their 30s for a majority of your life, which means not just pain-free, but functioning quite well. Fluid, oxygen, and nutrition flows are generated by pressure, as we had said. When you're under load of gravity, they're pushed out. So you need these unloading or traction to allow disc to basically be pulled into, or fluid to be pulled into the disc. We will lose height throughout the day, especially if we are dehydrated. So we want to make sure we stay hydrated, and we do these types of loading and unloading cycles to make that disc healthy. Okay. It also gives a little endorphin kick. People that have healthy spine, they do a little bit of traction and they feel phenomenal. So as I was saying, with the wobble chair does for the lower half of the spine what the cervical traction does for the top of the spine. The loading and unloading cycles are the motion that is applied through specific movements. And I've got a little wobble seat on my chair right now, so I'm going through this. It helps me when I'm sitting. And if I'm sitting at my computer for long periods of time, reviewing x-rays or whatever, I try to have a timer go off and I go do 10 tractions, or I go sit down in the wobble chair for a couple minutes just to keep that fluid hydrated, and I have very healthy discs. So all of us should be, especially as docs, we should be doing this for our patients, for ourselves, as well as our patients. We got a little technical difficulty here. Here it comes. All right. So number one, we stimulate new collagen necessary for repair of injured discs. We rehydrate the disc and increase its height. So think about pumping up, like inflating a tire. You increase disc, ligament, and tendon strength. A good example of that, I've had patients come into this program that we do with Pettibon work, and they are in worse shape from a spinal form and function and health-wise when they first come in. They get in a car accident after 4 to 6 months of care and doing their home programs. We re-x-ray them. They're actually very little injuries. They are healthier and stronger. So the proof is in the pudding when you use this equipment and this system. So we want to decrease the potential for injury, which is what happens when you restore the normal elasticity or close to of that ligamentous and disc tissue. The patient can undergo more violent, if you will, or traumatic type of loads and withstand them pretty well. So we want to lubricate as well, nourishes the spinal joints and cartilage, and prevents, I missed one there, hold on one second, I clicked too fast. Boom. There it is. Sorry guys. Prevents adhesions during healing and promote improved joint integrity. So form and function, think form and function, especially for the neck and the upper back. What is this therapeutic exercise? Well, with the wobble chair, we do like an X pattern through the middle, and that is a coupled motion. You're getting rotation and lateral flexion and forward flexion and extension when you're doing these movements to help increase their balance, flexibility, and stability. So we want to return that patient to, well, not even the pre-injury state, but even better. I mean, they can continue to improve for months, sometimes years. Why is this necessary? Well, the therapeutic exercise affects the body locally and systemically. When you are doing traction, cervical traction, when you're loading and unloading, you're doing deep diaphragmatic breathing, which oxygenates the cerebral spinal fluid. Gives you a feeling of, as I said earlier, it's kind of like an endorphin rush, like a runner's high, a little euphoria, and it helps to move fluid in the body, blood flow, cerebrospinal fluid as well. All are necessary. Movement of those fluids is necessary to remove waste, as well as, help us repair. And we all want to age gracefully, right? Okay, so this is a key component. It's an easy thing for a patient to do at home. So, first reaction to an injury is splinting or spasm. The muscle goes into contracture to protect you. That's, as I was explaining to a lady yesterday, she had had a bad accident 20 years ago, and her body's been slowly losing function, and she's in her early 40s, and just at a point in her life where she's had no answers. But everything made sense to her when we went through the fact that her ligaments were unstable, and they had been unstable. She had had great chiropractors adjusting her. She's had massage. She's had all these things. I had done that as well, and I shared my story with her when I first met Burl. I was broken, and this was a key component to my daily exercises. Burl was my doctor. I went down to Gig Harbor pretty much twice a week for 4 months and did these exercises morning and night. And the difference was amazing. And so I not only teach it, do it with my patients, but I do it myself at least 2 to 3 times a week to maintain function. And I've been in practice for almost 20 years. So it's a great tool again. So we want to prepare that injured patient. So by loading and unloading, we're starting to cause a restoration of normal flexibility. That scar tissue is kind of like this garbage tissue. It's stiff. It doesn't want to move. So every time you do a little traction, every time it builds and builds and builds, to pretty soon we're able to have this normal flexibility, and that allows the patient to not only move better, move more like they're designed to do, but they're out of pain relatively quickly. So, all right, additional benefits. We enhance musculoskeletal performance. Right now, we are blessed to have the #1 high jumper in the world as a patient, and we're working on restoring his function from some injuries. And so our goal is to get him back to Tokyo in 2020. He actually competed in Brazil for the U.S. in decathlon. So he notices an increase in his performance when he's doing things like the traction and the wobble and the things that, excuse me, the things that we do here in the office, which are all, our foundation is, again, in the Pettibon system. So if a patient is injured, if they've been doing this protocol at home with traction as one of the key components or the foundational components, the likelihood of them getting injured is lessened. The severity of that injury is going to be lessened. And again, I've put that to the test through doing some CrossFit things that I probably shouldn't have. But the exercises and the PTLMS and the things that we do in our system put me back together, which is great. Because I need healthy discs, and I want to be active and functioning the rest of my life. So let's go. Motion exercise necessary for a healthy life. Just been talking about this. So at home, the traction is, again, one of the base components of a patient's home care. They go home with this. We teach them. They have a portable wobble chair. They have whatever parts or pieces or all of the weighting system that are necessary to help support this new flexibility and strength. Excuse me. I haven't talked this much in a while. So we want them to, especially, we want this done twice a day. Preferably first thing in the morning, you get up, you have your 2 cups of water, do your traction, 60 reps, and put your weights on a wobble and hold. And then at night, right before bed, because when you do these exercises before bed, your body is more apt to take the change and make those changes faster. Okay. In the clinic, we use it prior to any adjustments, along with the thoracic roll, the wobble chair. Again, we want to warm up the spine before we do any type of adjusting or putting any type of adjusting force into the spine. A cold spine, you just have way better results. It's way more comfortable for the patient. And it's easier on you as a doc. You don't have to do as much work. And we all want to work less, right? We're hoping. So why do we want to use it? It lowers that resistance of the tissues along the spine. It helps to improve the cervical and lumbar lordotic curves, because as they're squatting down and they're pulling on that traction bar, they're taking a deep breath, they're kicking their butt out, and we're working on both curves at the same time. and it helps to rehydrate a thin disc. So if you've got somebody with degenerative disc and they may have some type of radicular pain, or they're losing function in their grip, which you test in your exam, you key that component of their history in the examination, and you bring them right over to traction unit and say, this is one of the most important tools for you. We got to get those discs back. So you're going to do this with water. You're going to have the salt water every day. You're going to do your MSM. You're going to do traction. And if they do that, those discs will come back. I've seen it more times than I can count, hundreds and hundreds of times. Again, I've been doing this system full time since 2000. So the proof is in the pudding. So we have the traction wall mounts for your clinic. There's two types. You have a two-piece wall mount, which has an aluminum knob that slides in a slot, pull it down. We have a T-bar wall mounted. That one is used for use of the carabiner. I've also seen and have here in the office, we got jib rails from a sailboat with a slide, and that works really great as well. It's kind of like the knob here, but it's pretty expensive. These are way more affordable, is what I found out. So, first video
To use the
we're going to
cervical
watch
traction
here
unit,
is
first
the
attach the rope to
traction
the doorstop
setup.
by inserting
So
the
go ahead and
rope
watch
through the lower
this,
loop
and I'll come
and then
back
over the
on
doorstop.
after it's
Next,
done.
place the strap over the door within about a foot of the door hinges and close the door. Pull down on the rope to take up any slack. The unit should hang on the inside of the door if possible. If not, make sure the door is closed securely. When tractioning, we place the bar either underneath the chin or on the forehead. If using underneath the chin, the bar should be at shoulder height. If placing on the forehead, plan on the handle being close to the nose, somewhere between the forehead and the chin. Before tractioning, we recommend some cervical warm-ups, which look like a flex and extend, a twist of the head, and then ear to shoulder. As you stand in front of the traction unit, you'll notice it looks like a smiley face, where the handle is the nose and the smile is the rounded piece. If using the fat traction, you'll know you're at the right height when the nose of the unit is at the same height as your nose. You'll put the smile behind the neck, real close to where the neck meets the occiput or the bottom of your skull. Notice he's holding the bar with his hands facing him, and his elbows are against the door. His knees are bent and touching the door, and his feet are approximately shoulder width apart. Now he bends the knees, going into a squat position, breathing in deeply on the way down. And you should feel a slight pull in the neck and upper back, and in some cases down to the lower back. You should be using about 10% of your body weight, as most of your weight will be supported by the arms and legs. And this shouldn't hurt. You do hold it for a count of 2 and then stand up while exhaling. Make sure to keep the arms from moving up and down, and the shoulder should be relaxed. Continue this motion while breathing, working up to 60 repetitions or about 3 minutes twice a day. We next want to talk about the height of the bar. Here you'll notice it was perfect for underneath the chin. The bar was at shoulder height. In this instance, the bar is too low, so he's having to go into a very deep squat, and you'll notice it ends up being close to his eyes when he's in the squat. Now I want to point out the rope. Notice how it buckles and moves up and down. It should remain taut, and the bar is in this instance too low. Simply tie another knot in the rope and then attach it to the doorstop. The knot in the doorstop is what you're seeing in this video. You'll notice it close to the door. And it is a similar process for fine-tuning any traction unit on a wall mount, that if you're needing it just slightly higher than the connection on the wall mount, you can simply tie a knot to make that fine-tuning adjustment. As with any new exercise procedure, you may experience some soreness afterwards, and this is normal. Feel free to use ice if necessary. We hope
Okay,
you enjoyed
everybody.
today's webinar on behalf of the Pettibon.
If you have any,
To use the cervical traction,
our final clip here. Hold on one second. Okay, so I want to thank you for joining us today. If you have any questions, feel free to contact the Pettibon system through any of these links. And if you have questions for me specifically, they can put you in touch with me. So take care and have an awesome day, and go out there and change some lives and use these tools, because they do make a huge difference in the lives of your patients. All right, take care, everybody.
We hope you enjoyed today's webinar on behalf of the Pettibon system. Thank you for joining us. Please follow us on Facebook, LinkedIn, and Pinterest. Links to those are in the resources button. Check our social media and website for upcoming webinars. Again, on behalf of the Pettibon system, thank you for joining us. We'll see you next time.